Urinary tract infections, commonly referred to as UTIs, are among the most frequent infections, affecting millions of people each year. These infections occur in any part of the urinary system, which includes the kidneys, ureters, bladder, and urethra. While both men and women can get UTIs, women are significantly more likely to experience them due to anatomical differences. If you've ever had a UTI, you know how uncomfortable and frustrating it can be, and understanding the symptoms, diagnosis, potential complications, and management strategies is crucial. Hi, I'm Dr. Knapp, family medicine physician, here to bring you medical information so you can take control of your health and make the most of your doctor visits. The urinary system is responsible for removing waste and extra fluids from the body. The kidneys filter blood to produce urine, which then travels through the ureters to the bladder, where it's stored before being expelled through the urethra. When bacteria, most commonly E. coli from the gastrointestinal tract, enter the urinary system and begin to multiply, it can result in a UTI. The symptoms of a UTI can vary depending on which part of the urinary system is affected. However, there are several classic symptoms that many people experience. One of the most common is a strong, persistent urge to urinate, even when little to no urine is produced. This can be accompanied by a burning sensation when urinating. Urine itself may appear cloudy, have a strong smell, or in more severe cases contain blood, which is known as hematuria. Some people also report lower abdominal discomfort or a sense of pressure in the pelvic area. If the infection spreads to the kidneys, which is a more serious condition known as pyelonephritis, the symptoms can escalate. In addition to the usual UTI symptoms, someone with a kidney infection may experience fever, chills, nausea, vomiting, and pain in the back or side just below the ribs. Kidney infections require prompt medical attention to prevent complications. When diagnosing a UTI, healthcare providers will typically begin by discussing your symptoms and medical history. This will help guide the diagnosis and determine if further tests are needed. A urine sample is often required to confirm the presence of bacteria or signs of bacteria. This test, called a urinalysis, can detect the bacteria, blood, or pus in the urine. In some cases, the urine is also cultured to identify the specific type of bacteria causing the infection, which can help guide treatment. If the infection is recurring, or if your symptoms suggest the infection has spread to the kidneys, further tests such as imaging of the urinary tract or cystoscopy to examine the bladder may be recommended. While UTIs are generally easy to treat, they can sometimes lead to complications if not addressed promptly, or if they are recurrent. One potential complication is the progression of the infection to the kidneys, which can cause lasting damage. Kidney infections can be serious and may lead to permanent kidney damage or even sepsis, a life-threatening condition where the infection spreads to the bloodstream. Another complication is recurrent UTIs, defined as having 2 or more infections within 6 months or 3 or more within a year. Some people, particularly women, are prone to recurrent infections due to factors like anatomy and hormonal changes. In postmenopausal women, for example, changes in estrogen levels can lead to thinning of the tissues in the urinary tract, making it easier for bacteria to enter. Recurrent UTIs can be particularly frustrating to manage, and in these cases, a healthcare provider may recommend additional testing to rule out structural abnormalities or other underlying conditions that may be contributing to the frequent infections. People with conditions that affect the urinary system, such as kidney stones or an enlarged prostate, are also at higher risk of developing complications from a UTI. These conditions can obstruct the flow of urine, allowing bacteria to multiply more easily. Diabetics are also more vulnerable to severe infections due to changes in immune function and higher glucose levels in the urine, which create a more favorable environment for bacterial growth. Fortunately, UTIs are usually straightforward to manage with appropriate treatment. The first-line treatment for most UTIs is antibiotics, which help to eliminate the bacteria causing the infection. Your healthcare provider will choose a specific antibiotic based on the type of bacteria identified, your medical history, and any antibiotic allergies you may have. It's important to take the entire course of antibiotics, even if you start to feel better before the medication is finished. Stopping treatment too soon can lead to the bacteria becoming resistant to the antibiotic, making future infections more difficult to treat. For mild cases, symptoms often begin to improve within a few days of starting antibiotics. But more severe infections, particularly those involving the kidneys, may require longer treatment or even hospitalization for intravenous antibiotics. In addition to antibiotics, there are several measures you can take to help relieve UTI symptoms and support your recovery. Drinking plenty of water can help flush out bacteria from the urinary system. Avoiding irritants like caffeine, alcohol, and spicy foods may help reduce discomfort, as these can irritate the bladder. Over-the-counter pain relievers such as ibuprofen or acetaminophen may also help relieve pain and reduce fever. Pyridium is a pain reliever that can be prescribed by your doctor for discomfort associated with UTIs. For individuals who experience frequent UTIs, preventative measures may be recommended to reduce the risk of recurrence. For example, staying hydrated and urinating frequently helps to flush out bacteria before they establish an infection. It's also recommended to urinate after sexual activity to help remove bacteria that may have entered the urethra during intercourse. Wearing loose-fitting clothes and cotton underwear can help keep the genital area dry, reducing bacterial growth. In some cases, healthcare providers may recommend prophylactic antibiotics for individuals with recurrent UTIs. These are low-dose antibiotics taken either after sexual activity or on a regular basis to prevent infections from developing. However, long-term use of antibiotics should be carefully monitored to prevent antibiotic resistance and other side effects. For postmenopausal women who experience recurrent UTIs, vaginal estrogen therapy may be recommended. This treatment helps restore the natural pH balance of the vagina and strengthens the tissues of the urinary tract, making it harder for bacteria to colonize. Cranberry juice and cranberry supplements are often mentioned as natural remedies for preventing UTIs. While some studies suggest that cranberries may help reduce the risk of infection by preventing bacteria from adhering to the walls of the urinary tract, the evidence is mixed. If you choose to try cranberry products, it's important to use them as a supplement to, rather than a replacement for, medical treatment. In some cases, particularly when an abnormality of the urinary tract is identified, surgery may be necessary to correct the tissue and prevent further infections. This might include removing kidney stones, treating an enlarged prostate, or addressing structural issues in the urinary system. So UTIs are a common and uncomfortable condition, but they are generally easy to diagnose and treat. Recognizing the symptoms early and seeking prompt treatment can help prevent complications. If you're prone to recurrent UTIs, it's important to work with your healthcare provider to identify potential underlying causes and explore preventative strategies. With proper management, most people can recover from a UTI quickly and reduce the risk of future infections. If you suspect you may have a UTI, don't hesitate to reach out to your healthcare provider for evaluation and guidance on treatment. Thank you for watching. If you found this information helpful, please hit the like button and subscribe to my channel. Leave a comment below if you have any topics you want covered in future videos. As always, take care of yourself and make the most of your day.